Okay, so mostly everybody is in the meeting right now, and good afternoon, everyone. My name is Ashok Kedluri. My actual name is Surendranath, but I go by Ashok, my middle name. I am colleague to Alex. Alex is out of office this week, so I am covering for him. Welcome to the webinar training SSCP. Please feel free to ask any questions in the middle of the training, or we can have the Q&A session in the end, however you guys are comfortable. Subha, floor is yours, and please take over from now.
Thank you, Ashok. Good afternoon all. I see Aishwarya is here. Aishwarya, would you like to give any introduction to all our grantees who had joined us today?
Hi, good afternoon. I'm sure I can give a small introduction, then turn it over to you. Just wanted to say good afternoon to everyone. I hope everyone is doing well. Thank you all for joining this kickoff session as we are transitioning, submitting our small healthcare provider quality improvement performance measurements from EHP to Salesforce. So this presentation, as our team over here will provide an overview of the platform and any questions in regards to inputting this information in Salesforce. So thank you for all your patience through this process, and and please let us know if you have any questions regarding this presentation or any part of this introduction. But otherwise, I will turn it back to you.
Thank you, Aishwarya. Kathy from our training team would be presenting and going over the meeting content.
So welcome to the HRSA data collection platform webinar for the small healthcare provider SHCP grantees. My name is Catherine, and I'll be your facilitator today. I also have some people from our project team in the chat on the call with us to help with any questions anybody may have. So today we're going to walk through the new system, the HRSA data collection platform. For some of you who have not completed performance reports before, this is all going to look brand new, but for other people, it may look a little bit similar if you've already had grants previously. The new season, as mentioned a little earlier, is going to replace the old EHP's PIMS, where you previously completed your performance reports. So we will be walking through some screenshots of the system first, and then Jerry, who's also on the call, will be providing live demos. Please note that as we go through, we are going to be looking at some test information, some test data, and that's going to look a little bit different than what you're going to see. When you do finally log into your account, you will only see the programs and grants that you are associated with. And then at the end of our chat here today, we'll answer any questions you have. So throughout the presentation, please feel free to put any questions you have in the chat box, and we'll do our best to answer them either in the chat box or at the end of the call. So first things first, we have a little agenda for today. We're going to start off with a quick overview of this change and who's going to be affected. Then we'll look at how to access the new HRSA data collection platform and how to navigate the homepage. Then next, and probably most important to most people on this call, we'll talk about how you complete and submit your performance report. We'll also take a look at how to view your approval history and your approved reports. And then we will show you how to respond to any change requests from HRSA. And then finally, we'll show you how to access your grantee raw data report. So let's get started with an overview of this transition. So before we get into any of the system details, let's look back at the background for this transition. So as of August 1st of this year, any performance reports created for SHCP program grantees will be created and submitted in the new HRSA data collection platform. This new system has an updated look and feel, and it's easier to navigate. It's also hopefully will give you a better experience throughout while you're completing and submitting your performance report than our previous reporting system. As a reminder, this will only apply to performance reports created on or after August 1st, 2024. So that'll encompass the reporting period of August 1st, 2023 to July 31st, 2024. So your submission open date will be August 1st, 2024, and your report due date will be August 31st, 2024. So now let's take a look at how to access the system and navigate through the home page. So starting on August 1st, you're going to use this link to access the new HRSA data collection platform. So when your performance report is set up, you'll receive an email with this link to the system. While this is not a part of the HRSA EHBs, the two systems are connected. They talk to each other. So you will still use your EHB's login.gov email and password to complete your two-factor authentication to access the system. So if you do not have a login.gov account for the EHBs yet, now would be a great time to go ahead and create one. And we have some HRSA wiki pages that help you walk through the process that we're going to be linked in these slides. These slides, along with a video of the whole webinar today, will be sent to you guys following the webinar, so you can use those to walk through any access issues that you have, or just the first few times you're using the system. You can use those to guide you. So the home page, it looks a little bit like this. In the top right-hand corner, you'll find your username. If you click on your username up here, you'll have an option to log out. You can select your CVD performance reports either from the top navigation bar or from the widget down at the bottom of the page, and that will give you access to your reports. You can select data extracts either at the top of the page as well or from the widget at the bottom, and that's going to give you access to your grantee raw data reports. There's also a help option in the toolbar and in the widgets at the bottom of the page that will take you to the help pages. And in the middle of the page here is a little bit of background information on the purpose of your performance report. So now that you know how to access and navigate the system, let's look at how to complete and submit your performance report. So after you've selected the CVD performance report from the top of the page, the navigation bar, or from the widget at the bottom of the home page, you will see the performance report that's assigned to you. Under this view, you can see the tracking ID, the submission status, if it's applicable at this stage, the submission name, your grant number, your program name, your reporting period, and the status of the report. You can access the report by clicking the tracking ID right here. On the performance reports page, you can also select different list views to find the report that you're looking for in different statuses. So the page automatically defaults to recently viewed, but if you click the down arrow next to recently viewed, you can select a different list view. You can also change the default list view by clicking the pin once you've selected the list view that you would prefer. You can search for a specific performance report by using the search box on the right-hand side by entering either a tracking ID or a status. If you click on the approved reports list view, it will display reports that the HRSA project officer has approved and that are set in approved status. If you click change requested reports list view, then that will display any reports that your HRSA PO has returned for updates. Then those reports would need to be updated and resubmitted to move out of that list view. The in progress reports list view lists any reports that have not yet been started or that are in progress and have not been submitted. So that means that anything that's in not started status or in progress status would be in the in progress reports list view. Recently viewed, which is our default, will show all of your recently viewed reports. So anything that you've opened and looked at recently will show up in your recently viewed. And then our last list view at the bottom of the list is the submitted reports. That one will show any reports that have been submitted to HRSA for review and that have not been either approved or change requested yet. Next, We're going to see what it looks like after you open that performance report. So at the top of the page, you're going to be able to view your tracking ID, as well as details about the grant and your performance report, such as your submitted date, if applicable, or the review status. So for this one, that review status would be not started, and we don't have a submission date because it hasn't been submitted yet. In the grantee data entry section, you'll be able to see the status for each of your forms. So a status in progress is indicated by an orange clock face, and then complete is a green check mark. If you want to view a read-only version of the form, you can click view here. Or if you would like to start editing your report, you can click start or edit if you've already started and the form is in progress status. Down at the bottom right of the page, you can click generate PDF to view a PDF version of the entire report itself. And at the top of the page, once all of your forms have been completed, a click for approval button will appear and you can submit for approval. Once you've submitted, you can also track your approval history at the bottom of the page under approval history. And just so everybody knows, you will not be able to see that submit for approval button until all forms have been completed. Then you'll see that button appear and you'll be able to click submit for approval. So if you when you first click into that first form, you're going to see the public burden statement. You want to review the statement and then click next to continue to the data entry fields. So throughout all of the forms that you're going to complete, you will see that you can track the progress on the right side under steps. The step that you are currently completing will have a blue circle next to it, and it will turn green as you complete it. So if we click next, then we would see that next to public burden statement is a green check, and the step that we're currently on, access to care part 1, now has a blue circle. As you work through the form, be sure to complete all required fields. They'll be indicated by a red asterisk next to the fields. You can compare your data from previous reporting periods if that's applicable. If an incorrect data type is entered, a required field is left blank, or a dependent field does not match, then you will receive an error message to correct that data. So in this example down here, we had to enter a whole number, but a partial number was entered. Oops, sorry about that, guys. A partial number was entered, so we'd update that to a whole number, and then that error message would go away. Some fields do become required based on what you enter in their dependent fields. So if you enter data in a value field, the corresponding specified field will become required. Now, once you've filled out that form, at the bottom of the form, you will see an add comments section or an attach files option as well. These are both optional and they will follow that entire form. So every step, they will have this option at the bottom of the form. After you complete the data on your step, you want to click next at the bottom of the page, and that's going to save your data as well as move you to the next step. So here I want to pause for a moment and just give you guys a really important piece of information. The system does not have a save button per se, it only has a next button. So the system is not live capturing your data. It doesn't save information until you click next. So if you were to click back or you were to return to the main page, then you will have lost your data if you did not click next. So we don't want that to happen to anybody. So make sure anytime you're stepping away from your computer or you're navigating away from the form that you're currently on, you're clicking next to save that data. You will, of course, have to fill out any required fields within that form in order to be able to move forward, but please make sure that you could always go back and update that information if you entered something that was a temporary placeholder, but we want to make sure that you're not losing your information and wasting your time. Also, the system will time out after 15 minutes of inactivity. So if you have to take a call you want to check emails, you need to go to a meeting, please make sure that if you need to save the information on the page that you're currently working on, you click next to save, and then you can move back to the page that you were working on later. Once all required data is entered on the form status updates to complete, as you can see on these forms. And then once all of the forms have been marked as complete, then you can submit the report to HRSA for review. So you would click that Submit for Review button at the top right of your page. You'll get a pop-up window when you click Submit for Review that allows you to, once again, add optional comments. Feel free to add any information you want to include for your PO if necessary, and then click Submit. Then your updated report will go to the submitted status and it'll move to your submitted reports list view. Okay, so now let's take a look at how to check on the approval status of your report. So after submitting your report, you can track the progress through the approval history section. As the HRSA PO makes their decisions, you will see if they approved your report or if changes were requested down here at the bottom under approval history. You can also see any comments that they added to the report while it was being submitted, approved, or changed. And on the right side of the screen, next to comments, you can click this down arrow to view a full comment if the preview window doesn't allow you to see the full comment. Once approved by HRSA, the performance report will update from a reviewed status to approved status, and it'll be listed on your approved reports list. So now that we've talked about change requests, now let's talk about change requests, making updates requested by HRSA. So if HRSA sends back a report for updates, you will receive an email notification with the comments that your PO added about the requested change. The performance report status will then move to change requested, and you will be able to access your report in your change requested reports list view. You would then click on your tracking ID to open the report to make changes. When you open the performance report in the approval history section, you can see the comment that your HRSA PO added about the requested change. And once again, if it does not fall within the preview window, like our example here, then you would click the down arrow, oops, sorry about that, next to comments, and it's going to show you that whole entire comment. Then you would go to the applicable form or forms that you needed to update by clicking the edit button next to them. And then once you've made the updates requested, you would submit for review again. It's really important that anytime you guys make the updated request, once it's good to go, that you submit for review. Another thing to keep in mind is that you will only have the ability to update your report while you have it initially or once it's come back for change requests. So once you make that, before you make your initial submit for review, you want to make sure that you've double checked everything that you've entered so that it'll make its way through the approval process a little bit quicker. And now that we've walked through all of those steps, we're going to hand it over to Jerry to actually show us in a live demo what the system can do.
Catherine,
Yes.
give me just one moment here to share my screen. All right. All right. There we go. So now you should all be seeing my screen. And the screen that you are seeing is the home page that you will see as grantees when you log into the HRSA data collection platform. The first thing it does is welcome you to the HRSA data collection platform. And as Catherine mentioned, over to the right, you'll be able to see your username. And if you click on the username, you will have an option to go to the home page or to log out. Here on the home page, at the top, you have a tab for home. You have a tab for the CBD performance reports, a tab for data extracts, and a tab for help. you have corresponding widgets at the bottom for the CBD performance reports, data extracts, and help. The CBD performance reports is where you're going to see your performance reports where you're reporting your performance. The data extracts is where you can see additional reports, mainly for you. That'll be the the grantee raw data report, and the help button or help option is where you'll be able to see additional resources to help you as you navigate through the system. You'll see user guides for various divisions, including the CBD division, and you'll be able to click on that information and get additional information, as well as go to frequently asked questions and get information there. So that's the help page that you will see. And I want to go back and do our main focus, which is the CBD performance reports. And then we're going to take a look at the data extracts tab at the end before we close up, before we wrap up today. So when you click on the CBD performance reports tab, that is going to bring you to where you can see a list of your performance reports. As Catherine mentioned, this demo is in one of our sandboxes, and it is for demonstration and training purposes only. All the information that you see here is for demonstration and training purposes only. You'll be logging into the production instance or the live version of the data collection platform, and there you will only see reports that are associated with your grant and your grantee organization. So don't be alarmed if you see reports here for other programs. As I said, this is for demonstration and training purposes. So when we click on the CBD performance reports, first thing you see is the recently viewed list view. This is showing you all of the reports that you have recently viewed. You can change the list view by clicking on the little arrow or caret next to the words recently viewed, or clicking on the words recently viewed themselves and choose one of the other list views. Your other list views are going to be approved reports that you have submitted to HRSA, to your program, and the program officer or other HRSA staff have approved your performance reports. Change requested reports are going to be reports that you submitted to HRSA, to your program, to the SHCP program, and your PO or other SHCP staff have asked you to give additional information. So they've asked for changes to be made to your report. Your in-progress reports are going to show you any reports that you're currently working on and your reports that are not started. So if your report has a status of not started, it'll also be listed under in progress. And your recently viewed reports, which are your reports that you've recently viewed, and your submitted reports, which are going to be the reports that you submit for review by the SHCP PO or other staff, but have not yet been reviewed. So they're in the submitted status. And you can change your list view by clicking on one of these other options. And you can even pin the list view that you want by clicking on this little pin here. So if you always want to see, when you first log in, you always want to see your in progress reports, you can pin that so that, and we got that little success button there, that now the in progress reports are pinned. So anytime that I go to the home page and I first log in and I click on CBD performance reports, now that I've pinned it to in progress reports, it's going to always open up to the in progress reports. Or if you just want to see things that have been change requested, you can go to your change requested reports and then pin it again. See, we got that success message again. Change requested reports was pinned. And now anytime that we click on the CBD performance reports tab from anywhere else on the page, we will see our change requested reports. I'm going to go ahead and change this back to our recently viewed reports. And since that is the default, but if you want to change that, you can change it by going to the different view and clicking on the pin. And I'm going to go ahead and pin recently viewed. So the next time I come back, it'll show me my recently viewed reports. So that's an option that you have. So now that we've looked at the list views, let's look at the reports page itself and the information that you see here. The first column you see is going to be the tracking ID. This ID is generated by the data collection platform system. It's how we track your performance reports in the system. So you can see if you're referring to CBD 00678 or CBD 00722, that's your tracking ID. The next column is your submission status. The statuses will either be on track or past due. The next column is the submission date. Usually that is the fiscal year that you're working in for this particular performance report and the program name, so FY20 SHCP. Then your grant number and your program name. Go ahead, spread that out so you can see the full header. Program name. We're going to be looking at the SHCP reports. The reporting period, which shows you the report period start and end date, and the status. And in this case, we have one report that is in progress and another report that's not started. I am going to go ahead and switch over to in progress for just a second. Remember, I mentioned that your in progress reports are going to show you reports that have a status of in progress and reports that have a status of not started. And so that is the information that you see anytime that you click on the CBD Performance Reports tab. You see this information about your reports. So now let's look at the individual reports themselves. So I'm going to open up the report on the second row first, 00678. It has a status of not started. I just want to show you what a report is going to look like the very first time that you open it and you haven't done any work on it. So when you open the report and you haven't done any work on it, the first thing that you're going to see is that CBD Performance Report Tracking ID. Then you're going to see an expandable header. And in that expandable header, you'll see your grant number, you'll see your grant organization, and you'll see the reporting period start and end date. If you expand the header, then you will see the grant number, your grantee organization again, your current reporting period. In addition, you will see the report due date. You'll see the review status for this report, which is currently not started, and you'll see the submitted date. If you haven't submitted your report for review, then the submitted date will be blank. Anytime that you submit your report for review, the submitted date will be filled in. And if something happens and you have to submit the report again, the submitted date will be updated to the most recent date that you submitted the report. Below the expanded header, we have what we call the grantee data entry section. And in the grantee data entry section, you can see all of the forms that are associated with this particular performance report. You can see that there's a legend here to show you the status for each individual form. Not started is a red circle, in progress is a yellow clock, and completed is a green circle with a check mark. And because these forms and this report is not started, each one of these forms is not started. It's our first time looking at it. So they all have a red circle. And when they have that red circle, for each form, you're going to see that you have the option to view the form, which will allow you to read the form, see the form in read-only mode. You won't be able to make any changes, just be able to see the data that's there. Or you'll be able to click the start button to start working on the form. Now, once you begin working on a form, you won't see a start button anymore. You'll see an edit button, because after the report is started, you won't see a start button anymore. You'll see the edit button. Also in this grantee data entry section, you're going to see the option to generate a PDF. And we're going to come back to generating PDFs later, but I did want to mention it because it's in this section. And then I'm going to scroll down a little more and you'll see the approval history section. The approval history section is also expandable like the header. Currently, there's nothing in the approval history. So it's showing 0 records in approval history because the approval history starts tracking from the moment that you submit your report, and then any response you get back from your program officer or project officer at the SHCP program. And so This is what it looks like when you're working in a report that is not yet started, has a status of not started. I do want to mention that this review status of not started is different from the status of each individual form is not started. In progress and have forms that are not started, or it could be in progress here or completed here. The forms could be completed and still have a status of in progress. This review status is the status of the review. Have you started the report? Is the report in progress? Has the report been submitted? Is a change requested, or has it been approved? So the review status here corresponds to what you see as the status here when you're looking at your list of reports when you click on the CBD performance reports list. And I came back to the CBD performance reports list because I want to jump into our in progress report here, which is 00722, CBD 00722. I'm going to click on that. And now we're looking at a report that is in progress. At a glance, you can see that we've got forms with different statuses than not started. First thing I want you to notice is now that work has begun on this report, there's a note there at the top for you to please complete all forms in order to be able to submit the report. And as Catherine mentioned before, you won't see that submit for review button until all of your forms are complete. Next, you see your tracking ID again, and then we have our expanded header. Once again, it's showing us that grant number, grantee organization, and reporting period. When it's collapsed and when it's expanded, it's showing us, in addition, the review date, the report due date, the review status, and the submitted date. And now, since we're working in a report that has been started, the review status is in progress. And if we scroll down to the grantee data entry section, we can see that there are all the forms are here that are associated with this performance report. And the forms have different statuses. Green circle means that the form is complete. A yellow clock means that the form is in progress. And we can view the report in read-only mode. And instead of start buttons, we have edit buttons. So I'm going to go ahead and click on, and our approval history is still at 0 because this report has not yet been submitted. There's no submitted date. So I'm going to go ahead and jump into the very first form, your demographics form. I'm going to click on the edit button. And in form 1 of your reports, the first thing you're going to see is the public burden statement. This is the public burden statement, and this public burden statement includes the OMB control number for this project and information about the expiration date of the OMB control number. So you can review that public burden statement and get the details of what your public burden is there. And then you'll notice that below the header for public burden statement, there's a back to main screen button. So I'm going to click this. It's going to take us back to the main screen here where we can see all of our information we previously looked at. That's what that back to main screen button does. And you can access that from any form. Let me just refresh real quick. Looks like I got logged out. Give me 1 second. This is one of the fun parts of working in a test environment. You won't have this problem because you'll be logged in. The system does time out after 15 minutes, so you may need to log back in. Just give me 1 moment to log back in. But you'll just log in by putting in your username and password. So I'm going to click back on our CBD performance reports. And I'm going to go back to our report that we were looking at. And click on the edit button for form 1. And we have our public burden statement our back to main screen button. And on the bottom here, you'll notice there's a next button. This is how you're going to navigate to the next step within the form. And the steps that you have for this form are listed here. The step that has the blue circle on it is the step that you're currently working on. So you can see as you make your progress through the steps in the form. So I'm going to go ahead and click the next button. And now in the steps, we can see that the step that we were just looking at and no longer accessing has a green circle with the check mark. And now we're in the next step, which is Access to Care Part 1. And here in Access to Care Part 1, we see the form number and the title of the form. We see any instructions associated at the form level. Again, we see our expandable header, which shows the same information that we saw on our main screen button. We have our back to main screen button, and then we begin seeing the subsections. This first subsection is the number of people, and this subsection has instructions for you as well as you're putting in your information. You can use this information to determine what is required of you as you go through the measures in this form. Now, this first measure, number of counties served, you're going to notice that number of counties served has a little red asterisk next to it. That indicates that this is a required field. So you would have to put information in this field before you can move on to the next field. If you do not, you'll get a validation message, validation error, that this is a required field. And I'm going to go ahead and put my information back in. Other validations that you'll see, as Catherine mentioned, sometimes a field will not allow a decimal place. And so you'll get a validation error message letting you know that it allows whole numbers up to 10 digits. So you want to take out that decimal place. You won't be able to type in any letters in a field like that. And it allows whole numbers up to 10 digits. So if you exceed the 10 digits, then you'll also get a validation error message to let you know to make sure that the answer in this field complies with the validation standards for this field. Your next field is asking for you to enter information in, also a required field. This is a text field, and it's asking you to provide the names of the counties served. You're going to notice that this text field allows up to 2,000 characters. Most of our text fields like this allow up to 2,000 characters. You'll also notice that this is an expandable field. So if you put in up to 2,000 characters, you'd be able to expand so you can see all 2,000 characters. And I should mention that when you're looking at this first column is your current reporting period. Reporting period is where you can put in the information that you're currently reporting. The next column is the previous reporting period. Each reporting period shows the start date and end date for that reporting period. So for the previous reporting period, you can see the start and end date, and the same thing for the current reporting period. Your previous reporting period is going to be for your reference. It's going to show any information that was put in during the previous reporting period. You cannot make changes to the information in the previous reporting period. Those fields are going to be grayed out or uneditable for you. You'll just be able to view them in case you want to make comparisons to what's happening in your current reporting period. And I should mention that if you have any questions, you can put your questions in the chat. We have team members standing by who will be available to answer your questions for you as I'm going through this information.
I'm here.
So as we scroll down, we come to the next subsection, which is the target population. And in this next subsection, we see that there's a separate set of instructions for this subsection. And the question here is also required. And rather than typing in a number, it is a drop-down field where you can answer yes or no. If you answer no, you can just keep on moving on. If you answer yes, then you're answering yes to changes that are to the target population measures. Then you'll be required to give justification for those changes. So I'm going to type in something, and that justification is in a long text box, again, allowing up to 2,000 characters, and also, again, expandable. And so you'll be able to put in your full justification there and then expand it. And I do want to mention, let's see. Yeah. So we covered all that. All of these fields with the red asterisk are required fields. And then you'll come down to, and on each step, you're going to see a comment section. The comment section in a form are at form level. So if you put a comment in on step 2 of a form, you'll be able to see it on every other step of the form. So I'm going to put in a comment. And then we also have file attachments. So in the file attachments, you'll be able to attach any files that you have that you would like to upload to give additional documentation for the information that you're sharing in your performance report. You can do that by clicking the upload file button and just going to, I'm going to go to my desktop. I'm going to select a file. And as the file is uploading, when it's done, you get that green circle with the check mark. If you upload more than one file, when they're all done, the done button becomes active and you can click on done. And just like with the comments, your file attachments are going to be visible in every step in the form, but they are form level. So if you go from form 1 to form 2, you won't see the comments or the file attachments that you put in form 1. You will not see them in form 2. So next we come to our next button, and just above the next button, again, we see our OMB number and our expiration date. And then you have the option to click previous or next. If you click previous, that'll take you back to the previous page or the previous step. When you click next, all validations will be checked to make sure everything that you put in on this particular step meets all validation standards. And then once all validation standards are met, then the information you put on this page is saved. The only way to save the information, as Catherine mentioned, is to click the next button. So we click next, and that brings us to our next step in the form. We're now on Access to Care Part 2. We have, our form has a different name, Form 1, different section, instructions at the form level, and then we have our expandable header, our back to main screen button. We start seeing the subsections there and the instructions at the subsection level. And then we see more required fields, the number of unique patients, clients that receive direct services during the budget period. This is an important number. All of your demographics numbers that you put in will need to equal this number, and we'll look at that a little bit more. And then the number of project partners that you have. And then we come down to the types of direct service encounters that you have. And in this subsection, more instructions. And this is a checkbox area. I'm just going to uncheck this box for a second. The very first time that you log in, you will see this advisory notice advising you to select at least one option. Once you check at least one option, that checkbox will go away. You can check more than one option, but you're going to need to check at least one option. You won't be able to click to be able to proceed to the next step until you've selected at least one option in the checkbox section. We come to our comments, and here in the comments, we can see the comment that we put in on step 2 is now visible on step 3, and I'm going to go ahead and put another comment in. And we can see that the attachment that we added on step 2 is visible on step 3. And I'm going to go ahead and click the next button. And that's going to bring us to the next step, which is demographics. And there are additional instructions here. And our very first demographic subsection is the number of people served by ethnicity. And I mentioned earlier that field that you entered before, your total number of people served by ethnicity needs to equal the total number of unique individuals who received direct services. So right now, the total number of people who received direct services was 54, and our total number of people served by ethnicity is 54. If I change that, then we get another validation message reminding us that our total number of people served by ethnicity needs to equal that total number of individuals who receive direct services. I'm gonna go ahead and change this back. And so now our validation is there. Once again, we can see our comments that we put in our previous steps are there for us, as well as our file attachment. I'm gonna go ahead and click the next button. And we come to our next demographic section, the number of people served by race. And here, once again, you're going to put in each one of these measures is required. You're going to put in numbers for each measure, and the total number that you have should equal the total number of unique individuals who receive direct services. Once again, 54. We have our comments, we have our file attachments, and then we click next. And next we come to the number of people served by age group. You'll put in a number for each age group. The number that you put in should equal the total number of unique individuals who receive direct services. We have our comments, our file attachments, and then click next. And
What is it?
was there a question? I believe someone's unmuted. If you have a question, please put your question in the chat for now. We'll have time at the end when we can take your questions. We can unmute and give us your questions. Thank you. And next we come to the number of people by insurance status. And you'll see all the insurance status options there. You'll put in the numbers, and again, they must equal the number of unique individuals who receive direct services. And click next. And so now our form 1 is complete. We went through the entire form and clicked next on each step. So let's go to the next form, form 2, which is sustainability. I'm going to click the edit button. And we see at the top, form 2, sustainability, and then we see the form level instructions. Again, we see our expandable header and our back to main screen button. And then we see the subsection here, source of sustainability, and the instructions for this subsection. And then you have required fields here for all these measures. Each one with the red asterisk is a required field. You'll put in the number that you're reporting for each one of these measures. And then we come to the next subsection, which is incentives, payments, reimbursements from third party. You'll put that in, and you'll notice that this is other incentive payments, reimbursements from third party value. So you can tell us the value if you have an other incentive or reimbursement from a third party. You report that here. This is a required field, and you'll notice there's a corresponding specify field. This value field and this specify field are tied together. They're both required, but you could not put in one without the other. And in this other incentives, payments, reimbursements from third party payers specified, you can see again, this is one of our long text fields, allows up to 2,000 characters. As I mentioned before, you can expand the field so that you can see all 2,000 characters. And then we have the additional third-party payers. And Then the next subsection, again, required fields, you'll go ahead and fill those in, including all required fields. And we're on a new form, so these comments that we put in on the last form are not reflected on this form. If we wanted to have comments here, we'd have to put in new comments. Same for the file attachment. If we wanted to attach files to document the information that we're reporting here, you'd have to attach new files. And I'm going to scroll back up to the top and click the back to main screen button. So we looked at one step in this form, and you'll notice it's still in progress mode because I went to one screen and went through it, and I'm gonna go ahead and click next. For any changes that were made, back to main screen, it's still in progress. Your forms will not change to complete until you go through every step in a particular form and click the next button. So I'm going to click the next button on step 1, and then I'm going to click the next button on step 2. And now form 2 is complete. This may come up sometime. If that happens to you in production, just hit refresh. The platform that the data collection platform is built on is Salesforce, and sometimes it has a little hiccup, but it's easily fixed with just a quick refresh. And so now we can see that form 2, sustainability, is complete. And I'm going to go ahead and go into form 3. And I'm going to go through form 3 and click next. And on step 2 of form 3, I'm going to check my information and then click next. And so now all of my forms are complete. You can see that they all have a green circle with a check mark. And when all your forms are complete, that message at the top on the left changes. It now says all forms have been completed and validated. You may proceed to submit this report. You'll also notice that now that all forms are complete, you have a submit for review button. If you click the submit for review button, that's going to open up the submit for review window. And then submit for review window, you have the option to put in a comment. It's not required, but you do have that option. Once you put in your comment, if you're not ready to submit, you still have one last chance to go back and work on it by clicking cancel and going back and working on your forms. If you're ready to submit, you can go ahead and click the submit button. Once you click the submit button, you'll get that green banner popped up for a minute telling us our report was successfully submitted. Now that it's submitted, there's no message up to the left. Now that it's submitted, there's no submit for approval button on the right. If we expand our header, now we can see our review status is submitted and we have a submitted date. And in the grantee data entry section, we can see that we no longer have the option to edit any of the forms because they've been submitted. So you won't be able to edit them. You still be able to view them in read-only mode. And when we come down to our approval history, we can expand the approval history and see the most recent activity, which is your submission of this report. You'll see the date and time stamp, the status, the person who submitted it, and any comments that they added. And also, I mentioned that we would talk about the generate PDF button. When you submit the report, that's a milestone. That might be the point when you want to generate a PDF, or you may decide you want to generate a PDF at any point after you complete any one of the forms, just to memorialize the work that you've done. But when you click the generate PDF button, that's going to open up a separate window. And just give it a minute to open here. I need somebody to cue the Jeopardy theme music for me. There we go. So now the screen is loading. You'll notice that it says generate PDF here, and there's a faded out generating PDF button here as the preview window opens up for our PDF for CBD SHCP. And then we see our preview here once it comes in and it's fully loaded. Now we have the option to download the PDF. And you can open the file or open whether you keep your downloads and view the PDF. You're going to be able to see the program name at the top, your organization, your grant information, reporting start date, reporting end date, the report due date, the submitted, your public burden statement, and then all the information that you've submitted in the report. And you're going to see this in the same order you see it in the user interface. And then at the bottom of each page, you'll see the reporting period, the date this was printed, and what page you're on. And I'm going to jump back over here and close this window. And so that is our PDF. And so I want to do two things. Give me one quick second. I'm going to jump in as PO and give this report a quick review. And your program analyst or your project officer will be able to go in and change the status of the report to either approved or change requested. And then you'll be able to go back in and see it as change requested and make your changes. And you'll get that notification, as Catherine mentioned before. I am not seeing that option here. Oh, give me one sec. There it is. So your reviewer will give you any comments. And then the next time that you log in and come to the home page and you click on the CBD performance reports. Do that again, are you? Just give me one moment here. So the next time you log in, and click on CBD performance reports, you're going to notice that that report you were working on now has status of change requested. If you go to your change requested list view, you'll see it listed there. You can open it up. And if you expand the header, you'll see that your review status is change requested. If you come down to the approval history, you're going to be able to see the most recent activity on the top. with a date and time stamp. The status was changed to change requested, the person who changed it, and the comments. Your comments from your PO and any comments in the approval history are expandable. You can change from clip text to wrap text in the approval history. And now you can see the full comment that was put in by the PO and all the instructions that they're asking for when they're asking for the change. So now I also want to mention that those comments would be available for you in the email notification that you receive that the status of your performance report has been changed to change requested. So you would go through and make any changes that you want to make. And once you have your changes made, submit for review again, and your PO, your project officer, will review it. And if they approve it, then you'll receive a notification that it was approved. If they do another change request, they'll give you more instructions for any changes that needed to be made, and you'll do the submission once again. I do want to take just a quick minute and show you the data extracts tab. This is where you're going to see your reports. The data extracts tab defaults to show you your recent reports. So the first time you log in, you won't see anything here. Recent reports appear here. There's nothing here. So you want to go to all reports. It even says here, view all reports. So you want to go to all reports, and then you'll see all reports available to you. In this case, it's the SHCP Grantee Raw Data Report. And this SHCP Grantee Raw Data Report, when you click on the name, it's going to open up the report, and it's going to show you the information that you put in on your reports, on any reports that you have in the system. So all the reports associated, performance reports associated with your grant under the SHCP program, you will see here. In the beginning, you'll see the program name, your data collection start and end date columns, your grant number, your grant organization, the grantee state, the grantee city, the tracking ID, and then you'll begin seeing the measures that are in the report. You'll see them in the same order that you see in the user interface in the report, and you'll see the information that you put in each one of the measures. So you'll be able to go through this report and view it all. You can see where you entered information in those long text fields. The information is truncated on the user interface, but you'll be able to see that in one of the export options. I'll talk to you about that in just a sec. So you're able to go through and see all of this information in the order that it appears in the user interface. And for your Grantee Raw Data Report, you're going to have an export option. Click on the export button. You're going to see that you have two export options. The formatted report option and the details only option. The formatted report option is going to show you an Excel spreadsheet that looks a lot like what you see on the screen when you're looking at the report. It's going to have the same headers, the same grouping, the same filter settings, and the format for the formatted report. There's only one format option, which is Excel format.xlsx. If you choose the details only format, then here you're going to have more options. The details only is not going to include any of the headers, any of the groupings, any of the filter settings. It's just going to show you the information that you put in on each line with no frills. But when you're in the format of the details only, you can select your format. You have the .xls, the .xlsx, or .csv formats. If you choose the .xls, you'll be able to see the full long comments that you put in and any form comments that you put in. Form comments can be up to 5,000 characters. Those long field boxes can be up to 2,000 characters. They're truncated on the screen and they're truncated in the formatted report, but they are not truncated when you choose the .xls format. You'll also be able to choose encoding if the current encoding is not right for you. And you can click the export button and view one of these reports. I'm going to go ahead and shift back to the formatted report and click export and just open up the report for you really quickly. And our Excel spreadsheet opened. And as I mentioned, because this is the formatted report, it looks a lot like the report that you saw on the screen. And that's everything I wanted to demo for you. I do want to turn it back over to Catherine and let her close us out, and we can take any questions that you have. Catherine?
Hi, Jerry. Thank you. Okay, let me go ahead and share my screen again. So, thank you so much, Jerry, for covering all of that in the demo. There are just a few reminders that I want to go over before we get to questions. So, once again, the data will not save within the system unless you click the next button. So, if you're ever on a page where you have entered information, do not navigate away from it without using next if you wish to save that work. Also, like Jerry mentioned, and we talked about a little bit earlier, the system will time out after 15 minutes of inactivity. So once again, the system will not auto-save the page that you are on. Make sure that if you are stepping away from your computer or just navigating away from that page, that you are going to click next before you do so, so you do not lose any of that data that you've entered. Required fields are indicated with an asterisk, so they will not let you proceed if the required field has not been filled in. After you submit your performance report, you cannot make edits until your HRSA PO has requested changes. So make sure that before you're doing your initial submit for review, you're looking at that information, triple checking before you send it off to your PO. And then after your HRSA PO has requested changes, you need to resubmit the report for your PO to be able to review it again. So going in and editing the forms that they asked for is not enough to send it back to the HRSA PO. You will also have to click that submit for review button one more time. Just so you guys know, we will have a number of different resources available for you when this launch happens. So we'll be sending you a copy of this webinar from today in a video format. We'll also be sharing the slides that we used today for you to use while you're in the system. We will also have step-by-step guides and FAQs within that help tab or that widget, that help widget on the homepage that you can access at any time. If you do have any questions or issues about logging into the system, then I'm going to go ahead and direct you to the login.gov customer support team, and they'll be able to help you with that login.gov two-factor authentication or getting your account set up. If you have questions directly related to your actual performance report, then you're going to contact HRSA customer support, or you're going to contact your HRSA PO directly. And as always, if you have any questions about your actual grant or the data that you need for your performance report, you can reach out to your HRSA project officer for that. So, do we have any questions that haven't been answered in the chat yet that we can help everyone out with? Feel free to unmute yourself if you want to ask the question that way, or go ahead and put it in the chat if you have one now. So we have one question. Are my previous reports in EHB, or will they be loaded into Salesforce? Can anybody speak on that?
Yes, I just provide an answer for that.
Sorry,
Tom,
Jerry.
that's okay. I was typing while you were talking. I'm a slow typer, sorry. Fast talker, slow typer. So Tom, the previous reports that you have will be part of Salesforce. The most recent previous report will be reflected in that previous reporting period column when you're looking at the Salesforce user interface in your performance report. All other reports that predate that will be available to you in the grantee raw data report. As I mentioned, all of the performance reports associated with your grant organization are captured in that grantee raw data report, and that data from those previous reports will be listed there along with your current performance report that you're working on.
Does anybody else have any questions? Feel free to take yourself off mute or just enter them in the chat box if you do have any lingering questions about what we talked about today. I know that Jenny did go ahead and answer this question. But just so everybody knows, if you would like a printout, you can always use that generate PDF option. So if you're the kind of person that would like to record your answers beforehand on paper, you can print that out before you start answering any of the forms, and then you can enter that information as you wish in the system. Okay, great. Well, thank you guys so much for joining us today. If nobody has any other questions, then I guess we'll give you guys a little bit of time back in your day to do with as you wish. But thank you so much for joining us today. We really appreciate it, and we hope that you guys enjoy the system.
Thank you.
Thank you.
Again, thanks again.
Catherine.
Have a blessed day. Saeed, we can stop the recording now.